how to connect and everything.
Hi, Hines at Edward Hines Jr. Hospital, VA Hospital. I'd like to invite everyone here to our Facebook Live today. We're presenting on the Women's Veterans Program today. October is a very big month. In October, we celebrate breast cancer awareness, domestic violence awareness, and also pregnancy and infant loss. Today, Hines is going to showcase some of our wonderful programs that are here primarily for our women veterans. Our agenda today has some of our most fabulous staff. We're going to open up with Dr. Richardson today.
Thank you very much, Ms. Pitt, and welcome. Thank you very much for joining our Women's Veterans Town Hall today. I'm Michael Richardson. I'm the Chief of Staff here at Hines, and I want to again thank you for joining and hope that you will continue to have us, allow us to continue to give you your health care. We have a very rich program today, lots of things that are happening here, and as you heard and will hear, we are expanding and continue to expand what we do to honor our women veterans here at Hines, and to make sure that not only are we capable and able to provide you care, but that we provide you care with confidentiality, with respect, and with honor which you deserve. So again, I'm glad for your participation, and I look forward also to listening and learning. And at the end, I would ask you to send in your comments, questions, so that we can continue to improve and to do better in providing care for you. So thank you, and over now to our next, Dr. Kalapala, who's going to talk.
Welcome. First, I would like to thank all the women veterans for giving us this opportunity to serve you in your healthcare journey. My name is Hepsi Kalapala. I'm an internal medicine doctor by training. As Brenda mentioned, October is Breast Cancer Awareness Month. These are some of the statistics. Breast cancer is the second most common cause of cancer in the women in the United States. Skin cancer is the first one. And it's the second most leading cause of cancer-related deaths among women in the United States. Lung cancer is the first one. And out of these, 10% of breast cancers are linked to known genetic mutations. Few more statistics. You have seen this picture. 1 in 8 women in their lifetime will be diagnosed of having breast cancer. Unfortunately, the incidence is going up. But we have good news. Breast cancer related deaths are decreasing. This is because of increased awareness, early diagnosis, and better treatments. According to American Cancer Society, about 300,000+ new cases of breast cancer will be diagnosed in 2024 itself, and 42,000 women will die from breast cancer. Few more facts. Breast cancer occurs in middle-aged women and older women. Median age at diagnosis is 62, and small number of women are diagnosed at a younger age of 45 or less. How can we prevent it? As we all know, prevention is the key. Women have combination of risk factors. Some we cannot modify, some we can help ourselves. If we have high family risk factor, we cannot change that, as well as aging, we cannot change. Some of the things which we can do to help ourselves is maintaining healthy weight and eating healthy diet. Obesity increases the risk of breast cancer. On average, research showed women gain about 20 pounds after menopause, and this increases their risk of having breast cancer by 18%. Exercise helps not only in reducing the risk of breast cancer, but many other things like reducing diabetes, high blood pressure, heart problems. How much exercise do we need? On average, adults need about 150 minutes of exercise per week, which is 2.5 hours. We can spread this out as 30 minutes per day, 5 days a week. We all know alcohol and smoke increases the risk of several cancers, including breast, lung, mouth, throat, esophageal, colon cancer, and liver cancers. So please avoid alcohol and don't smoke. If you have to drink alcohol, drink in moderation. Few other facts. Women who had their first child after the age of 30 have slightly higher risk of developing breast cancer. On the contrary, breastfeeding helps in lowering your risk of breast cancer. Certain hormone replacement therapies, if used for more than 5 years after menopause, can increase the risk of breast cancer. Regular screening helps in the early diagnosis of breast cancer, and it's easier to treat. Mammogram. Mammogram is nothing but a X-ray the breast tissue, and the risk of radiation is very minimal with mammograms. At VA, we follow American Cancer Society guidelines to screen the women who are at average risk for breast cancer. So these are the guidelines. At ages 40 and 44, women should have the option to do annual screening mammogram. Between 45 to 54, it's recommended women should get mammogram every year. 55 and older, they can switch to every other year mammogram or choose to do mammogram every year. And they can continue as long as they are healthy. So who are the women who are at average risk for breast cancer? If you do not have any history of breast cancer, personal history of breast cancer, no history of radiation treatment to chest wall, and no history of abnormal mutations, you come under this risk. If you have any of these, you come under high risk for breast cancer. So how can breast cancer present? Breast cancer can present in many ways, like change in the shape of breast, or patients may feel lump, or change in the skin texture or color. If you notice any of these things, please do not ignore. Please reach out to your primary care physician. What does VA do to help the patients? Heinz VA facility has more than 30 primary care providers who are additionally trained. I stress once again, additionally trained to take care of women veterans and their complex health problems. At present, we do not have mammography on site for Heinz VA Hospital. We are doing through community care. So this is the process. Your primary care physician, when you're due, enters the mammogram consult, and community care schedules the mammogram appointment, and when it's done, community care reports the results to your provider, and provider informs the patient. If you have an abnormal mammogram, or if you have diagnosis of breast cancer, our mammogram care coordinator collaborates with primary care physicians, radiologists, and cancer specialists to help you to schedule your appointments. Here is the telephone number for our mammogram coordinator. I request patients, if you are due, kindly reach out to your primary care providers for mammogram order, either through secure message or through this telephone number that is listed below. VA also offers genetic counseling and testing, and this will help us to identify who are at high risk. This will help in early detection and intervention when needed. VA also provides high-risk breast evaluations and also provides medications for primary prevention of breast cancer. If you have diagnosis of breast cancer, you do not qualify for this medication. Your primary care provider help you to refer you to high-risk breast clinic and also identify if you qualify for these medications. Thank you all.
Okay. Good afternoon, everyone. Let me get to my slides here. My name is Maggie Elgersma. I am the chief of our Blind Rehab Center here at Hines. So I'm going to tell you a little bit about the services that we offer. So Hines Blind Rehab Center is here on Hines campus. It's building 113, so as you're driving onto Hines campus, looking at that main hospital, we are the building to the left of building 200, right in front of building 228. So you'll see us as you're driving onto campus here at Hines. So our mission at Blind Rehab is to provide high quality blind rehab through the provision of a broad range of rehab services, education, and research technology. Our goal of our center is to help visually impaired and legally blind veterans to become as independent as possible in all aspects of daily life and to assist them in their adjustment to blindness. For specifics of our Blind Rehab Center, we are a 34-bed inpatient facility right here on Hines campus, as I stated. We serve veterans from around the country. So what's kind of unique about Blind Rehab is veterans can receive our services if they're in another state. If this is not their primary location for services, they can actually still come to Hines for Blind Rehab. We offer outpatient services through virtual care, and then we also offer in-home services through Blind Rehab outpatient specialists that will come into the home. We have 5 different training areas within Blind Rehab that work with our veterans to maintain independence and increase independence after vision loss. And then also we have clinical support services. So we have an in-house social worker, psychologist, rec therapist, nurse practitioner, medical team, as well as 24-hour nursing care services. There are 13 blind centers across the country. So our blind center is the oldest blind center and the largest, established in 1948. But the 13 centers are spread out all over. So veterans do have a choice where to receive those services, but they're not at every VA. The nice thing about Blind Rehab, though, is there is what's called a visual impairment service team coordinator at every VA site. So that means that even if you don't have a Blind Rehab Center, that person is your gateway into all things low vision and blindness for you as a veteran. Just a little bit about our demographics. So we serve 93% male population, 7% female. That 7% is actually an increase over the last couple of fiscal years, so we're hopeful to see that number continue to rise. Our average age is 70, but a wide range. Actually just celebrated one of our veterans' 110th birthday on Sunday, so we definitely serve a wide range of veterans as far as age. 61% white, 30% black, and then 9% other or did not identify. As far as eye conditions, some of the common eye conditions we see: glaucoma, macular degeneration, optic atrophy, diabetic retinopathy, retinitis pigmentosa, which is a hereditary disease, and then acquired brain injury related vision loss. So that could be something like a stroke, that could be something related to a traumatic brain injury, any type of trauma that results in vision loss. So as I had mentioned previously, we're made up of 5 different skill areas. So the first one focuses in on orientation and mobility. This skill area is our veterans learning to walk around safely and independently, whether that be in the hospital, community, in their home area. So you may see some of our patients walking around the hospital with the long white cane, and they may be being followed by one of our staff. That's us training the veterans on how to utilize that cane to travel safely and independently. Our visual skills area focuses in on using a veteran's remaining vision effectively. So many times patients come into the blind center and they are not totally blind, meaning lights out, no vision whatsoever. They actually have some pretty good residual remaining vision, even if they are legally blind. So what we really try to do is focus in on that remaining vision and how they can use that effectively. Manual skills is an area where they're going to actually utilize non-visual skills. So they may try to increase hand dexterity, tactual perception, things that you wouldn't need to rely on your vision for. Computer access training is exactly what that sounds like. It's really accessing technology, computers, things like tablets, smartphones, different technology so that you can send an email, or maybe you want to go back to work and learn about a skill that requires you to learn technology. That area would cover that. And then the last one is living skills, and this is just activities of daily living. So it might be like cooking, cleaning, personal management, how to take care of your finances. I added a couple pictures just to kind of give a representation of what goes on at Blind Center. So the top picture is showing a computer program that magnifies the screen. The picture to the right is our music therapy program. That's through our manual skills department, so we do a lot with music therapy. The bottom left is orientation and mobility, where they're learning to travel with the long white cane. This is actually at an L stop, a local L stop, where we take our veterans to do some public transportation travel. And then the last picture is one of our staff utilizing what we call a head-mounted device, and that takes a picture of text and it will read the text back to you aloud so that you don't have to rely on your vision. This is really helpful for eye fatigue or when you're not wanting to utilize that vision for whatever reason. As far as inside the Blind Center, the top picture is a picture of our courtyard. So in the summertime, we try to take full advantage of the warm months in Chicago. And we offer a healthy eating program where we do some container gardening. So we're growing our own vegetables and some of our herbs, and then if we can, we utilize those in our kitchen classes, as well as we do an adaptive grilling class. So our veterans are able to go out, learn about safe adaptive grilling, and then provide that food, maybe it's to the patients or just kind of as a practice to do that program. We offer a wood shop, so a lot of our veterans come in and they have shops at home, and they're scared to use them after vision loss. They're scared to use that heavy equipment that maybe they once did before. So we provide safe and adaptive strategies to utilize that equipment safely. Bottom picture on the left is a patient room. So every patient that comes into the Blind Center for the inpatient program gets their own room and their own bathroom, TV, easy chair, all the things that kind of give you the comfort of home as much as it can in a hospital setting. And then the last picture on the bottom is of one of our kitchens. So we have 3 training kitchens. We try to adjust to what the veterans kitchen is like at home. So we have a flat top stove, we have a gas stove, an electric stove, so that we can kind of mimic what they're utilizing at their home. Related to women veterans, so we actually have some great initiatives for this year and the next coming couple of years. We were offered a grant, or we were awarded a grant through the Office of Health Equity. This really is a focus on women veterans who are specifically for visually impaired women veterans, and introducing them to immersive technology and virtual reality. So virtual reality is kind of a buzz right now going on, and we really wanted to take advantage of that opportunity for our visually impaired women veterans. So we're developing personalized health plans and addressing individualized goals and needs as they relate to recreation and whole health. So pulling in that whole health component as well. Also in partnership with the VHA Office of Healthcare Innovation and Learning, we'll focus on some suicide prevention, sexual harassment, and firearm safety through that initiative. Some additional things that we do in blind rehab related to our women veterans is just trying to bring in women veterans together. So if we have an inpatient and we know we're going to have a women veteran in, can we try to kind of bring them in as a group so that they have that experience to share with each other, have some camaraderie while they're there in the program, and some support and networking availability. We do offer women's support groups during the inpatient stay, so some of the staff may see some of our veterans at some of the support groups they offer out in the hospital, because we are offering those to our inpatient veterans as well. And then some of the things that we've done, just based on some of the feedback we've received from our women veterans, is just women care items available. So, many years ago, we were only really aimed at a male population, so we had a lot of things like aftershave and things that would really apply to men. But we're now kind of transitioning to different things that we can receive that would also be appropriate for women. So a couple other things I want to mention. One thing is we are very active in rec therapy. So Blind Center does a lot with our local just area community things. We do things with golf and horseback riding. We do fishing and swimming, skiing, and then we do take advantage of the winter months too. So we'll do some downhill skiing. We do archery, kayaking, and then we'll do some indoor things like yoga, tai chi, for inpatients that are not able to go out into the community. We also have really good working relationships with our VFWs and American Legions, so we'll take our veterans to outings there as well. And the last thing I wanted to talk about, and probably one of the most important parts of our program, is the family and caregiver integration into our program. So Blind Center actually offers a special program for families and caregivers to experience firsthand blind rehab services that their veteran received. So they can participate in a 1 to 2 day immersive experience. We will actually, if the veteran's out of state, will fly their family members in for a 2-day immersive inpatient experience. They would stay at the Fisher House, and then they have the opportunity as a family member or caregiver to observe the patient during their class time with the providers, and then also have a one-on-one consultation with each provider. So they're able to kind of get feedback, find out how they can advocate for their veteran and best support them when they return home. They have an opportunity to attend some of the rec events that I mentioned previously, and then the veteran and the caregiver are discharged home together. So they're able to fly home or travel home together when the program's over. Is there any questions? Sound like it. So thank you. Thank you for the opportunity.
Good afternoon. My name is Karen McLean. I'm the acting chief nurse for outpatient nursing service here at Hines, and I'm here to talk with you all about vaccinations and bringing you some updates regarding seasonal vaccines. We're going to talk about COVID-19 vaccination, flu shots, as well as the RSV vaccine. So it's important to stay up to date with your COVID-19 vaccine. Everyone 6 months of age and older should get a 2024-2025 COVID-19 vaccine. The COVID-19 vaccine helps protect you from severe disease, hospitalization, and death. It's especially important to get your 2024-2025 COVID-19 vaccine if you're age 65 and older, if you're at high risk for developing severe COVID-19 disease, or have never received a COVID-19 vaccine. If you have recently recovered from COVID-19, when would you get your vaccine? People who recently had COVID-19 may delay getting a COVID-19 vaccine for 3 months. The risk of getting COVID-19 is less likely in the weeks to months following an active COVID-19 infection. What if I already received the 2023-2024 COVID-19 vaccine? Most people should wait at least 2 months between the last 2023-2024 vaccine before they receive the new 2024 and 2025 vaccine. So if you've already received a vaccine, you should wait at least 2 months before you get the new one. Next, I'm going to talk about influenza or flu shot vaccine updates. It's recommended by the CDC that everyone 6 months and older should get a seasonal flu vaccine. The CDC recommends a yearly flu vaccine and says that it's the first and most important action in reducing your risk of flu and its potentially serious outcomes. Flu vaccines help reduce the burden of flu illness, hospitalizations, and deaths on the healthcare system each year. Flu vaccination has been shown to reduce the severity of illness in people who get vaccinated but still get sick. People at higher risk of serious flu complications include young children, pregnant people, people with certain chronic health conditions like asthma, diabetes, or heart and lung disease, and people 65 years and older. Vaccination is also important for healthcare workers and other people who live with or care for people at higher risk of serious flu illness in order to keep from preventing flu to them. The 2024-2025 flu vaccines are available here at Hines. All flu vaccines for this year are trivalent, The trivalent flu vaccine means that it's formulated to protect against 3 types of flu viruses: the flu A H1N1, the flu A H3N2, and the flu B/Victoria virus. There is a standard dose and a high dose flu vaccine. People 65 and over should get the high dose flu vaccine. The Fluzone high dose vaccine contains 4 times the antigen as the standard dose flu vaccines. People aged 18 to 64 who have had a solid organ transplant and are taking immunosuppressive medications are also eligible to get the high dose flu vaccine. Flu vaccines at Hines are available at all primary care clinics and CBOCs, as well as the front lobby of Hines Building 200 on a walk-up basis during normal clinic hours. You can also get all of your scheduled vaccines at your routine primary care appointments. The next vaccine I'm going to talk about is the RSV, or the respiratory syncytial virus. A one-time RSV vaccine is recommended to adults age 60 and older who are at increased risk, such as those with chronic health conditions. The CDC recommends all adults age 75 and older to receive the RSV vaccine. The RSV vaccine has an approximate 80% rate of effectiveness in preventing RSV. RSV can be very dangerous to older people, causing more severe illnesses such as bronchiolitis, which is an inflammation of the small airways in the lungs, as well as pneumonia. So ask your provider if you would benefit from the RSV vaccine. And next, I'd like to introduce Dr. Rodriguez Cabezas, who's going to talk about women's reproductive mental health.
Thank you for that introduction. So this month we wanted to shed some light on Pregnancy and Infant Loss Awareness Month. That is this month of October. So we wanted to bring awareness to this widespread issue that affects all groups. It unfortunately disproportionately affects more women of color. We want to reduce the stigma, the blame, and the isolation that women often feel when they are experiencing these types of losses. We want to connect women to mental health care to address these losses and provide resources for support. So just to give you some information about how common this can be, 1 in 4 pregnancies end in loss. 1 in 160 babies are born still. 24,000 infants die each year. No one has to go through that alone. Just to highlight the disproportionality of who it affects, unfortunately, Black women are twice as likely to experience miscarriage or stillbirth as white women. Perinatal loss can often have profound negative effects on bereaved parents, including depression, grief, anxiety, and PTSD, or post-traumatic stress disorder. Negative consequences such as stigma, blame, and isolation, and loss of relationships may worsen mental health outcomes. So the Reproductive Women's Mental Health Clinic is here to serve this population, anybody who's experiencing any kind of pregnancy or perinatal loss. The mission of the Reproductive Women's Mental Health Clinic is to provide evidence-based, patient-centered reproductive mental health services to women veterans, women spouses of 100% service-connected veterans, and transgender veterans. Across the lifespan, women may experience reproductive conditions and events that impact their mood, such as those I mentioned. The primary focus in the Reproductive Women's Mental Health Clinic is to address the intersection between the reproductive health and the mental health conditions that they might experience, such as depression, anxiety, and PTSD. The Reproductive Women's Mental Health Clinic offers a range of services from one-time psychiatric consultation to time-limited medication management and/or therapy. Referrals can be made from any primary care behavioral health staff, from the mental health intake center, from the maternity care coordinator, or any mental health provider. Our point of contact is Dr. Kate Colangelo. Her number is listed there, 708-202-4761. And if for some reason you're not already connected to any type of mental health care at Hines, you can call the Mental Health Intake Center at 708-202-8387 and then dial extension 23446 to schedule an appointment and ask about a referral to our clinic. Next, I'll introduce Renee Rouse. I hope I'm pronouncing that correctly. She's the Chief of Center for Civic Engagement.
Good afternoon. And I should say that the Center for Development and Civic Engagement is formerly known as Volunteer Services. So our new name is quite a mouthful. Our vision is to create a VA culture that serves the well-being of veterans through a strategic engagement of volunteers and community partners. Our mission is to strategically integrate volunteers, donation, and community partners into an operation so that they may supplement and sustain the care and services provided to American veterans. The volunteer program began in 1946 and is one of the largest volunteer programs in the federal government. We offer various opportunities throughout the hospital, which can help one to develop new skills and valuable work experiences. For those who are retired, it provides them with a chance to meet new friends. We also have these services for students who want to participate in volunteering. Our requirements is that you commit at least to 6 months, complete fingerprinting and background investigations, provide 2 forms of identification, and provide proof of a flu and COVID-19 vaccination. That's for all adult volunteers. If you're a student volunteers, they're not fingerprinted, nor do they have to go and provide proof of flu and COVID. They have an attestation form that's filled out by their local doctor that they would provide to us. If you're not able to volunteer, you can always consider in-kind or monetary donations to help out a veteran. All donations go through CDCE. And if there's someone you know or you are interested in volunteering or donating to assist our nation heroes, please contact us at the number listed on the slide. I also am going to address the food pantry. So the food pantry is operational in Building 9 in the auditorium. It's every Thursday, except if it ends up being the 5th Thursday of the month. The operation hours are from 10 to 12 or until the food is depleted. Most people arrive prior to 9 o'clock, and I mean, you'll see a very long line waiting to get into our food pantry. It's not income-based. All the veterans are welcome to attend and can come twice a month. And if you come on the 3rd Thursday, which would be November 21st, they'll be giving out food for Thanksgiving. If there's any questions, let me know. And I will be followed by Dr. Persky.
Thank you so much. So I wanted to spend a couple of moments sharing with you our whole health efforts. And, you know, when we consider healthcare, we are committed to creating non-judgmental space of support, space not only dedicated to treatment of various ailments and conditions, but also we're dedicated to promotion of wellness, promotion of strength, promotion of growth, and promotion of holistic and whole health care. So in whole health, we focus on what matters to our veterans, what matters to women who come through our doors or who receive care through our virtual modalities. And that's where it all starts. It starts with you. We focus on exploring your personal mission, your aspirations, and gather information on what purpose you see for yourself and for your life for those who matter to you. We really hope that we continue to focus on the question of what is important to you today, what matters to you now, and that's really at the center of our whole health service delivery. Just like the chief of our blind rehab spoke about incorporating whole health into those services, we really see whole health care interwoven with every area of service delivery here at Hines. It's about partnership. It's about partnership with you over time, where we explore what type of self-care you're engaged in now, what type of self-care you would like to see yourself participate in, what traditional care as well as complementary and integrative health services you are receiving or interested in receiving, and what resources are available in the community where you live. All of that, when we put all of those elements together, that's what creates whole health. And I wanted to share a couple of interesting findings from recent scientific research. Recently, there was a study of over 276,000 veterans aimed to estimate mortality when looking at various factors in lifestyle medicine, so various lifestyle behaviors. And as you can see, these lifestyle behaviors overlap with various domains of whole health care. And what we found is that, this research study has found, is that life expectancy increased significantly when all 8 lifestyle factors are adapted. For men, it was a difference of 24 years, and for women, it was a difference of 20.5 years. And in the quote, actually, I just noticing blank space, but what it says is that lifestyle medicine treats the underlying causes of disease rather than its symptoms. It provides a potential avenue for altering the course of our healthcare costs that are incurred in part as a result of prescription medications and surgical procedures. So in whole health, we believe that it's the entire spectrum of healthcare, including medications, including necessary surgical intervention, and lifestyle factors that are so critical and so important. And because we also appreciate that making lifestyle change can be challenging, this is why we focus on what matters to you now in your life and where you would like to focus in at this time in your life. So you may want to start with focusing on how you move your body and then explore further drink, or you may be someone who is interested in addressing some of your sleep concerns and then incorporate power of the mind into your everyday life. So there's no one place to get started. We're here to support you in the way that is most meaningful to you. There is also another research study that looked specifically at implementation of whole health in some of our veterans hospitals, those that were first to implement approaches consistent with the model of whole health. And that included offering taking charge of my life and health groups for veterans, health and wellness coaching, various complementary and integrative health modalities such as mindfulness and yoga and Tai Chi. And what the researchers found is that more women than men tended to use whole health services. So there's a particular interest among women to receive whole health, holistic care. And looking at those veterans who were followed 6 months into them receiving whole health services, what the researchers found is that women engaged intentionally more frequently, right, in all types of services. And for both men and women, there was improved satisfaction and engagement, greater improvements in communication elements of life, and greater positive trends for women specifically in mental health outcomes, stress management, and overall their self-reported well-being measures. So it was really meaningful to see that we are gaining evidence, not just from stories, but from, you know, kind of a more intentional research studies that look at trends and the impact that our services have on healthcare. I also wanted to point out for those who are interested in podcasts that on the podcast, She Wears the Boots. This is a podcast specific for women veterans. Ms. Allison Whitehead from our National Office of Whole Health described in depth complementary and integrated health approaches that are offered by the VA as part of our whole health system, and discussed how to access these services and specifically why women veterans might especially benefit from these approaches and why women veterans find these approaches appealing. So I definitely invite you to listen into the podcast. And speaking of podcasts, last year, our Hines VA Health and Wellness coach, Carissa Lee Captain, joined America's Heroes Group podcast to discuss what health and wellness coaching is and how it can benefit our veterans. So if you are curious to learn more and if you would like to connect with our whole health team, please don't hesitate to call us. It's a direct line to our whole health team, or ask any of your healthcare providers to put in a referral, and we'll be happy to reach out and share with you more information about whole health and support you in discovering what matters to you and how we can support you in moving forward in your health care. And I would like to turn it over to Erin.
Thank you, Elena. Okay, let's see. Let's make sure her. So good afternoon. I'm Erin Hanrahan. I'm the Intimate Partner Violence Program Coordinator here at Hines. The Intimate Partner Violence Program, also known as IPVAP, because VA goes by lots of acronyms, provides comprehensive and supportive services to veterans, their partners, caregivers, and VA employees who are either experiencing or using intimate partner violence in their relationship. The VA cares about veterans affected by domestic violence and intimate partner violence, and we recognize that intimate partner violence is a serious yet preventable public health epidemic that affects veterans. October is recognized as National Domestic Violence Awareness Month, and our theme is Building Relationship Health and Safety for Life, which aims to increase awareness of the critical importance of relationship health and safety throughout a person's lifetime. Some of the services that we provide in the IPVAP program are offering support and education to identifying healthy, unhealthy, and unsafe relationships. We provide safety planning, conduct assessments and screenings to identify unhealthy and abusive relationships, and we also provide 2 clinical brief counseling interventions. You see the QR code on the slide, and you can access our public-facing website for more information. I also want to take a moment that we've learned from our veterans that they believe that it's important in our healthcare system to ask about their relationship health and safety to improve their overall physical and mental and overall well-being. So consistent with the VA national policy, we've begun screening for all women veterans age 47 and younger and all high-risk vulnerable populations. Some of the high-risk vulnerable populations are women veterans, LGBTQ plus individuals, minority and indigenous cultures, individuals with disabilities, and individuals living in rural areas, and veterans living with HIV. Screening will be conducted at least annually, and resources and referrals will be offered to support health and safety and well-being. Research indicates that veterans want to be asked about the relationship health and safety in our healthcare system, and we know that more people who are screened for the experience of relationship abuse are more likely to seek help and leave an unsafe relationship. The VA has launched our White Ribbon campaign that will also be observed through the month of October, but all year round. As the White Ribbon VA campaign seeks to eliminate sexual harassment, sexual assault, and IPV in VA healthcare settings. We are proud to have initiated this conversation about the meaning of White Ribbon during Domestic Violence Awareness Month, where the relationship health and safety is unveiled. The symbol throughout incorporates the white ribbon, so white ribbon being the color white that supports White Ribbon, and purple, the traditional color for domestic violence awareness, into one unifying symbol. And lastly, I want you to know that help is available and that you're not alone. So please reach out to the numbers listed on the screen. My phone number directly at 708-202-7243, or our national public-facing website that you see listed, www.socialwork.va.gov/IPV/index.asp. And you can also watch for information on our Hines websites for additional messaging on intimate partner violence. And next, I'm going to bring up Lori Bustry, who's going to talk about who's our LGBT plus veteran care coordinator. Thank you.
Hello everyone, I am our LGBTQ plus veteran care coordinator, as well as our health promotion disease prevention program manager here at Hines. And October is LGBTQ plus History Month, so I'm here to talk a little bit about our LGBTQ plus veteran care program, as well as my role here at the Hines VA as the LGBTQ plus care coordinator. Lesbian, gay, bisexual, transgender, queer, and additional minoritized sexual and gender identities, or LGBTQ plus veterans, experience stigma and discrimination, which can affect their health. LGBTQ plus veterans are 2 to 3 times more likely to engage in suicidal behavior compared to heterosexual veterans, and transgender veterans are up to 20 times more likely to engage in suicidal behavior than cisgender veterans. LGBTQ plus veterans deserve appropriate and affirming care, and we want to make sure that our LGBTQ plus veterans know they are welcomed and respected at VA. A little bit of information about the national program for LGBTQ plus health. The program was created in 2012 to promote health and well-being for LGBTQ plus veterans and create cultural change in VA around LGBTQ plus affirming care. And in 2016, VA required each facility to have at least one LGBTQ plus veteran care coordinator at each facility. The LGBTQ plus veteran care coordinators are responsible for facilitating affirming care. To support LGBTQ veterans, I can help our facility and veterans by connecting veterans to resources at the VA, at Hines or another VA, should they choose to go to another VA, and as well as in the community. I work to build a safe and welcoming environment, develop ways for providers to support LGBTQ plus veterans and their health at our facility, provide education and training for staff, and directing any veteran to resources used to identify safe spaces and allies. Specifically related to care that we have available, we provide all medical and mental health care treatment that's available to every veteran, but Hines also offers 2 support groups. They're named Service and Pride, which is for all LGBTQ plus identified veterans, as well as a transgender-specific veteran support group. We have hormone therapy available, gender-affirming communication treatment through speech-language pathology, and gender-affirming prosthetics and wigs. Other care can be coordinated through other VAs, including hair removal. We also use community care for specific services as well. A few things that I wanted to point out to folks that are things that you can do to help make sure that we are identifying you as the veteran that you are in the correct way. You can include your self-identified gender identity and preferred name in your medical record. This way we can always identify you in the way that you would prefer to be addressed. To enter your gender identity and preferred name, you can do so on va.gov. Click sign in the upper right hand corner, and then on your profile you can update personal information. If you would prefer to have this done while you are at Hines or one of the CBOCs, if you get your care there, you can speak with somebody who works for eligibility and they can do this for you as well. You may be asking, what is self-identified gender identity? That is the field where the veteran will describe their gender identity. It may be the same as or different than your sex assigned at birth. No documentation is required to change this field. And as I said, it can be entered on va.gov by yourself or via the eligibility staff at one of our facilities. The options are male, female, transgender female, other, does not wish to disclose, or non-binary. As far as what is a preferred name can be a nickname, a middle name, or any other name that you prefer to be called. It's simply what you would like us to refer you to as when we address you either by phone or while you're here for an appointment, etc. Some examples: James may be preferred to call Jim, Michelle may prefer to be called Shelly, or Tim may prefer to be called Tammy. There's a variety of different reasons or names that a veteran may prefer to be called, and they are able to update any of those or update that on their record as well. Sorry, I skipped ahead there. Another thing that we can record in your medical record is your sexual orientation. So sexual orientation is asked of veterans so that we can provide the best patient-centered care for you. Currently, 50% of Hines veterans have this information in their chart, and we continue to collect it at patient visits. So when you are asked by your healthcare team, you may choose from the following options. It also includes a free text if none of the choices fit your sexual orientation. And I won't read all of those that are available, but they will be listed to you as you're asked that question by your healthcare team. And they're also on the screen. If you or someone you know was discharged based on sexual orientation, you may be eligible for VA healthcare and other benefits. Laws have changed since specific policies that kept veterans from accessing care. So please visit va.gov/discharge-upgrade-instructions or call 877-222-8387 to learn more. If you would like more information about our LGBTQ specific healthcare or have any questions at all, you can reach out to me at extension 21228 here at the Hines campus. You can also check the VA website. So this is the national website, www.patientcare.va.gov/LGBT. And there is a spot that I've circled on this screenshot where you can subscribe your own email address to get updates from the national office regarding anything new related to LGBTQ plus care at the national level. If you have, again, things specific to Hines that you would like to ask or needs, you can reach out directly to me at 21228 here at Hines. Thank you so much.
I'd like to end today's program with this very important message. Women are veterans and women belong at the VA. As you can see from today, we have world-class healthcare and world-class programs specifically for our female and women veterans. Again, please reach out, use this as a resource, Share this with your friends and fellow veterans. And please come to Hines or your nearest VA because women veterans belong here. Thank you.